It's called Conversations for Life because these conversations are not only about the quality of life we hope for our last days of living and making our preferences known about that. It's also about the fact that we live with these conversations whether we held or avoided them forever. Loved ones live with the facts of the death of someone close to them, and there's something that we can do about this. We can't prevent death, but we can impact and influence our care. As a daughter, I now know how important these conversations are. I know the difference it made to know and be able to support, if at all possible, the care for my mother and to allow her to live her last days at home where she wanted to be. And the difference between that and my father, who we didn't know as much then, and he didn't have the same options available. I also know that we all are carrying these stories, and we don't realize that we can influence significant amounts of the care, both for healthcare professionals who are learning to be more comfortable with this, as well as for the public. We do want to inspire people to consider and have these conversations so that they know what they need to know in time to make a difference for their care or someone they love. However, I don't mean to imply that this is easy or that death is pretty. The dying process can be quite challenging for people. It's physical, just like a birth, but we don't expect a birth to be pretty or easy. It's a physical process, yet it's one that we've come together around in society to make a difference, to support the individual wishes of mothers and families and coming together around that. And we can do the same and should do the same around their last days of living, whatever our beliefs or hopes or preferences are. We don't mean to imply that this is easy, and we don't mean to imply that just by having these conversations, everything goes without a hitch. These are challenging situations medically, logistically, emotionally, for some people spiritually or with their beliefs. Yet if we have the time to consider them in advance, we can make a difference and we can influence our care. I'm in the privileged position of hearing people's stories. And what I know from their stories and from my own is that we actually do want to have these conversations. And we want those around us to have the peace of mind of knowing they did everything they can. Although these conversations are about the care that we want for the end of our lives, what I know is when you start having them, you start talking about what matters most now. You realize that we don't have forever. And I've seen mothers and daughters talk about not only what they want for their last days, but how much they care about each other. I've seen couples tell each other how much they love each other when they may have never spoken those words before. Somehow, the fact that we're all united by the fact we're not going to be here forever helps us connect in something that's really what matters. And to be able to honor someone's last days is the greatest privilege we can unite around.